Good morning, everyone. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. My topic today is a very important one. It is about coronavirus disease in 2019, or what's called COVID-19. All of us know that coronavirus affecting the whole world nowadays. What we wanted to discuss in our journey today: the source of the virus, the pathogen of coronavirus, how it is transmitted, and what are the symptoms and signs, and investigation should be done to reach the diagnosis, and how to prevent, and the lines of treatment, and effect of coronavirus disease on pregnancy, labor, and breastfeeding. Let's go. Coronavirus are large family RNA virus that are common in people and many different species of animals, including camels, cattle, cats, and bats. Animal coronaviruses may infect people and then spread between people. As you see in this picture, this is SARS, or severe acute respiratory syndrome, which happened in 2003 in Saudi Arabia. And this one is MERS, which is Middle East respiratory syndrome, in 2012 in China. And this is the new virus, new coronavirus disease in 2019 in Wuhan, in China. Actually, SARS, the outbreak in 2003, has a case fatality rate 9.6%, and MERS in 2012 in China has a case fatality rate approaching 34%, and the COVID-19, or new coronavirus, about 2.5%, and still we don't know if it will be fixed to this or be more or less. SARS has an outbreak, MERS has an outbreak, COVID started as an outbreak as declared by the WHO, and now it is pandemic. The novel coronavirus that was first detected in Wuhan city, China, has now been detected in more than 100 locations internationally, including the USA. The virus has been named SARS-CoV-2, and the disease it causes has been named coronavirus disease 2019, which is abbreviated as COVID-19. SARS-CoV-2 is a beta coronavirus like MERS and SARS. All of them belong to beta coronavirus. The group or the family of coronavirus include alpha, beta, gamma, and the delta. And all the SARS, the MERS, and the COVID belong to beta coronavirus. As you see in the picture, this is the host, this is the bat, which is the host for the virus and from which transmitted to this animal, pangolin, and then to the human. And this is the development of the new coronavirus. This is the outbreak which declared by the WHO on January 30, 2020, but on March 11, 2020, WHO declared the new coronavirus as a pandemic because it affects different parts all over the world and they make a huge problem. Today is March 14, 2020. The total cases about 46,623 and the total deaths 5,416 and total recovered patients 70,903. How the virus transmitted either by person to person through droplet infection when the patient cough or sneeze and the distance between them less than 6 feet, or by contact with infected objects or surfaces, and by touching the surface or objects that has a virus on it, and then touching one's own mouth, nose, or eyes, yes, you can transmit the infection. So, two methods for transmission of infection. What are the symptoms and signs? Mainly fever, cough, especially dry cough, shortness of breath, fatigue, and myalgia. In more severe cases, infection causes pneumonia, which is complicated by severe acute respiratory syndrome. Arrhythmia may develop, and heart attack, and liver dysfunction, and acute kidney injury, and maybe even death. Reported illness have ranged from mild symptoms, which is the majority of cases, to severe illness, which may constitute about 16%. If suspicious symptoms, what should the patient do? The patient should call her doctor before the visit. The patient should tell the doctor about all symptoms, travel history, and any recent close contact with someone who has coronavirus. And this is how the chest lock on radiology with affection of the lungs by pneumonia because of coronavirus. People are at higher risk of severe illness are those old patients, and the risk increase with the increase of age. I mean, 70 is at risk more than 60. Also, people have chronic medical conditions like heart disease, hypertension, diabetes, lung disease, immune deficiency disease, or under treatment for cancer. Factors to consider in addition to clinical symptoms: does the patient have recent travel from an affected area? Has the patient been in a close contact with someone with COVID-19 or with patients with pneumonia of unknown cause? Does the patient reside in an area where there has been community spread of COVID-19? This is very important questions. Preparing for an assessment. First, isolate the patient in a single occupancy room, preferably a respiratory isolation room, and ideally under negative pressure, as you see in this picture, under negative pressure to avoid transmission of infection. Wear personal protective equipment as a minimum, and this should be fluid-resistant surgical mask, single-use disposable apron, and the gloves and the eye protection, as you see in the picture. Ask the patient to wear surgical face mask while transporting them to the isolation room to avoid also transmission of infection to other people. The investigation needed is nasal or throat swab or endotracheal aspirate or blood sample to detect the SARS-CoV-2 virus. CDC developed a PCR test to diagnose COVID-19. If the patient has a serious chest complaint, you should do chest CT image and bilateral involvement in most patients with pneumonia. And this is what makes pneumonia in this disease is risky because it is usually bilateral if developed. Of course, you will do lab investigation, CBC, and you may see lymphocytopenia, thrombocytopenia, and leukopenia, and sometimes leukocytosis rather than leukopenia. How to prevent? There is currently no vaccine to prevent coronavirus disease or COVID-19, but researchers are running nowadays to search for a suitable vaccine for this disease. The best way to prevent illness is to avoid being exposed to this virus, and this is what the world is trying to do these days. There is important instruction to people, steps to protect yourself and steps to protect others. You should tell the people about them. Steps to protect yourself. Ask the patient, clean your hands, please. Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains 70% alcohol. Ask the patient also to avoid touching their eyes, nose, and mouth with unwashed hands. Ask the patient to avoid close contact with people who are sick, with fever and cough. But put distance between yourself and the other people if COVID-19 is spreading in your community. You should tell the patient about this or the people. Steps to protect others. Stay home. People who are mildly ill are able to isolate at home. Should stay away from others in a specific room and away from other people at home, because you don't want to transmit infection from the patient to other healthy people at home. Also, should use a separate bathroom if available, because there is some researchers say that the transmission occurs through the bathroom, through the toilet, and the passage of the tubes, the organism pass in the feces. Patients shouldn't share dishes, drinking glass, cups, eating utensils, towels, or bedding with other people. Also, limit contact with pets and animals. And as you see the picture, this is what you should do, and this is what you shouldn't do. You should do this, you shouldn't do this. Steps to protect others. Again, avoid public areas. Avoid going to work, school, or public areas. Avoid using public transportation, ride sharing, or taxis. Cover coughs and sneezes. Please cover mouth and nose with tissue when cough or sneeze, or use the inside of your elbow. Use the tissue in a trash. Immediately wash hands with soap and water for at least 20 seconds. And if soap and water are not readily available, clean hands with hand sanitizer that contains 70% alcohol, as you see in the picture. Steps to protect others again. Wear a face mask if you are sick, when you are around other people. Also, please clean and disinfect frequently touched surfaces daily, which may include tables, doorknobs, light switches, desks, phones, keyboards, toilets. This is very important because the virus can live few hours on hard objects. What about the treatment of coronavirus disease, COVID-19? There is currently no specific treatment or vaccine, unfortunately, but research is running about this. Supportive care is the mainstay of management for all patients. Give the patient fluids to reduce the risk of dehydration, and give the patients medication to reduce the fever, and give organ support. Also, advise the patient to take healthy food and multivitamins. Older people and people with severe chronic conditions should take special precautions. And of course, cardiac patients, hypertension patients, chronic lung disease patients should receive the treatment. Diabetic patients should be controlled. What about the more severe cases? Should be hospitalized, isolated, and they take all measures for infection control. And sometimes some severe cases need ICU admission with oxygen to the patients and the IV fluids and possible mechanical ventilation. Several trials for medical treatment as remdesivir, chloroquine, ritonavir, ABNO1, and favlivir are under investigations for use against COVID-19. Of course, most all of them nearly antiviral drugs except chloroquine, which is anti-malarial drugs. Researches are done about these drugs to show if it will be effective or not. What about coronavirus 19 and pregnancy? The recommendation from Royal College of Obstetricians and Gynecologists in 2020 depend on the data coming from China mainly and from other parts of the world, but still the data insufficient. Let us start with these guidelines. To date, there is no scientific evidence about the increased susceptibility of pregnant women to COVID-19. And the pregnant woman should take the same preventive action to avoid infection recommended for all other adults. Treatment for pregnant women with suspected or confirmed COVID-19 infection should be provided with the supportive service recommended by WHO. Currently, no data suggesting an increased risk of miscarriage in patients with COVID-19. There are case reports of preterm births in women with COVID-19. Currently, it is unclear if COVID-19 can cross through the transplacental route to the fetus, although there is case report about vertical transmission either antenatal or intrapartum. Currently, it is unclear if COVID-19 can cross through the transplacental route to the fetus. This is proved in a case series study. Current recommendation for continuous electronic fetal monitoring in labor. Method of delivery depend only on an obstetric indication, whatever vaginal or cesarean section. Epidural anesthesia and analgesia is better if there is no contraindication. However, if there is no severe illness and no chest trouble, general anesthesia also can be used. But the risk of general anesthesia is from fearing that may spread the infection with using of anesthetic drugs. Efforts should be made to minimize the numbers of staff members entering the room. An individualized decision should be made regarding shortening of the second stage of labor with instrumental birth in symptomatic woman who is becoming exhausted or hypoxic, like forceps or vacuum, as you see here in the picture. Mothers with mild symptoms can breastfeed and wear a mask when near a child, including during feeding. Wash hands before and after contact with the child, including feeding, of course, and clean contaminated sources. If mother is too ill to breastfeed, she should be encouraged to express milk that can be given to the child via clean cup or spoon while wearing a mask. Washing hands before and after contact with the child and cleaning or disinfecting contaminated surface is an important protective measure. This is the end of the lecture. Thank you. I'm Dr. Ala Musbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University.